Good afternoon, everyone. It's good to see you again. I don't know about you, but this time of day, being together with the governor and lieutenant governor have been sort of the anchor for me these days. It's a flurry of busyness before. Spent the morning at the Emergency Operating Center, and we'll continue back there afterwards. And we go way into the evening, but somehow we always end up back here together. So it's good to see you. I'm going to go ahead and start with some of our data and announcements. First of all, I want to share with you today that we have created a new dashboard and a new website facing a feature that is very interactive. I want to thank again, I've been calling them the Force, but they are these amazing data analysts and predictive analysts who are working to bring you the kind of data that the governor has promised and in trying to be as transparent as possible. So you'll find our new dashboard will be interactive. You'll be able to see more about county level age, demographics. And we've also changed how we are showing our cases for the disease detectives and people who are following this. We're doing the symptom onset date. So the actual date when people had symptoms, it gives us a little better understanding of when the disease was first with us, remember, all the way back in February, now from the onset of symptoms as the cases come. So it's not just the cases, remember, but asking people when they really first were experiencing the symptoms of coronavirus and COVID-19. So today we are announcing that we do have 867 people who have tested positive. Still, again, it's a lag time. We have lots of labs out in private labs. We know with our lack of testing, we're not seeing all the cases that are out there that we're presuming, especially people in the outpatient setting, we're presuming to be positive and asking to stay home because we can't test as much. We're testing the higher risk folks in hospitals. And then our total hospitalizations, you see at 223. We know that we have 60 counties. In Ohio, we have 88 counties. We now have spread to at least 60 documented counties. Unfortunately, we are now reporting 15 deaths in Ohio. We also know that we are staying around the area of 11% of our cases are ending up in the ICU. Also on our website, we have information about the age range of folks ending up in the ICU is from 23 years of age to 92 years of age. And next slide, please. So again, that's a little bit of our data. We're updating as best we can the amount of testing we've done, 17,000, over 17,000. And again, we're highlighting our healthcare workers. We are looking at 17% of those testing positive are in healthcare workers, and we really are trying to track the impact on our healthcare capacity, as the governor said, on folks that are on the front line, not just our nurses and our docs, but folks in nursing homes, our EMS, our firefighters, and our police. And also I want to say our local health departments, we have 113 local health departments in Ohio, and we can share with you today that one in the Toledo area, and they'll be sharing more with you through the media, actually had 2 cases, and much of their health department is now in either isolation or quarantine. This is something we're planning for. It's something that my team and I are planning for. You have to think a lot about redundancy and backup. We know with 40 to 70% of us eventually getting it over the course of a year, that we have to have backups, and we're being very strategic about who's staying at home in case even myself were I to get sick, who will replace me during those 14 days where I'm staying home before I return. So this has to be part of our contingency planning. So that is news from the front lines. Next slide. So once again, we are knowing that most people will not be hospitalized, but in Ohio, we're seeing a lot hospitalized still, and we're starting to be able to look at who's actually going from hospitalized to the ICU. Next slide. So this is new, and I'm telling you, this is This is something I want everyone at home to pay attention to, because this is the effect of what you're doing. This is our first look at Ohio's curves, similar to the curves I've always been showing you. And it's very important to say that everything you have been doing, this would have been us by our projections. And again, this is beginning data. The more testing, the better these models get. But from what we can tell, and we have some great modelers coming out of the Cleveland Clinic and OSU and all our faculty working with my team, this would have been the peak of our surge had we not taken the decisive and important actions. I can't tell you enough, this is so important. We have got to even clamp down more. We have got to stay at home, and we can't go the other direction right now, because you can actually see a shift. But what we're seeing, and you can see how it's a shaded, ranged area. This will be on our website. This is our curve in Ohio based on the mitigation that we have done. And you can see it's a range, so the better we do, the more we push it out, the more we lower that curve. Remember that we have a hospital capacity line somewhere in here. We have, through our collective work together in Ohio, decreased that impact on our healthcare system by anywhere from 50 to 75%. That's crucial, but we've got to do it even more, because we are buying time, as the governor said. The further we spread out that spread of infection, the more time our hospitals are getting ready and doubling their capacity. But also, you know, I need you to know that it's not if but when. We will surge. At our peak surge, we may be as high as 6,000 to 8,000 new cases a day. So we're trying to keep that number. We're fending that off as long as possible. Our hospitals are gearing up more capacity, and we're also lowering that curve, and less people are getting infected. So that is going to make all the difference in our ability to handle this. We will exceed our capacity, but we've really been minimizing that amount. So Ohio, what you're doing absolutely is saving lives. With this, we see our peak is moving out toward, that surge is moving out toward the end of April. We'd like to get it even further out toward the beginning of May, because it will keep shrinking each time we do that. I want to add that Dr. Fauci shared some preliminary research. I was reminded of it when the governor shared the old St. Louis and Philadelphia curve. We know that they're going to be kind of different high points. It's not going to be a smooth curve. We don't yet know the effect of seasonality on it. We do not think it will go away completely, but anytime we let up on these measures right now, we can actually see surges again. So it's very, very important we follow those directions. Next slide. I want to talk a little bit about our need for PPE. This is also so crucial, and the moves you're making now by staying at home are actually helping us maximize the protective gear our frontline workers have. Right now out in the field, this slide shows what a typical month usage is by our hospital system and our nursing homes. And we know already mitigated versus unmitigated. If we had done nothing, we would already be way exceeding, but because we're doing things, we're staying real close to what we have. But we know still that we're gonna need extra, both of gloves, gowns, and surgical masks, but the moves you're making are making our supplies go longer. The big one we're looking at are those N95 respirators. Those are the specialized masks for hospital personnel, not the surgical ones or the ones we might even make at home to not spread infection. But it is those specialized masks. We know even with the efforts we're making, we're gonna need millions more. But we would have needed 65 times as many as our typical usage. We've lowered that down to 40 times as much. So again, everything we're doing is making all our gear last longer. Next slide. Our hospital capacity, we've been told, is at about 60% with our heavy flu season. But I want to talk a little bit more about the specialized parts of hospitals. This slide will show you what we have available is in the light blue, what we're utilizing right now in our hospitals based on OHA, Hospital Association data. These are negative airflow rooms that allow us to keep that infection from spreading in the hospital. ECMO, which is a basic type of oxygenation for very, very sick, our sickest people, ECMO it's called. We're only using about 13% of that right now. We have more capacity in light blue, but what our numbers are showing is that we know that we are gonna either almost double what we need above this. So we're gonna have room to use right now, but as that surge comes, we're actually building out more capacity because we know we're gonna go up above what our hospitals normally have as their capacity. This is ICU beds, our medical surgical beds, and our ventilators. So we have capacity, we need more. We're doing unique things about repurposing anesthesia machines, repurposing something called CPAP, positive airway pressure machines. We're doing new tubing where more than one person can be on a ventilator at one time. We are inventing things. We are building out hospitals and existing building structures, but we know we will need more. Next slide. So that is sort of a summary of some of the data. We're going to have more for you every day. As the governor said, we're working closely with our hospitals in a regional model to build out our capacity. We'll have more on that for you. One thing I'd like to touch on, a hospitalized patient is in a hospital with coronavirus, with COVID-19, for up to 20 days. Remember I told you about by the time you're diagnosed, remember from when you're first infected, it might be 5 to 14 days before you show symptoms. It's another 9 to 12 days between someone who actually has a disease might need hospitalized. It's another week or more before they might end up in an ICU, and our fatalities, our deaths follow those ICUs by up to 4 weeks. So everything we're seeing is lagging. And it's a lot like restaurants. They try to guess how many tables they'll need for a night, and whether we realize it or not, they're trying to flip those tables every hour to hour and a half. And that's how they staff, and that's how they know how many tables they'll be able to fill. And that's, you know, what we're looking at is more like a long 4-course meal. Even though our hospitals have capacity that they usually gear up for, they're often looking at staying times of 3 days. But we know that we're gonna hit peak capacity that we've never seen before in this country, and that folks are staying longer. And so that's why we know we really need to increase our capacity in our hospitals. Everything you're doing matters. It's life and death. And folks, please pay attention. You see what's happening in New York. You see what's happening in places like Louisiana. This is real, and everything each of us is doing matters. Last night I had a phone call with my husband. My husband, Eric, has been a school teacher for 35 years, most of it an elementary first grade teacher. He's also a coach. He works a lot with people driving the school buses, and we got a call from a close colleague. And Jennifer, I'm thinking of you. She, here in Franklin County, lost her father yesterday. And she called to ask again about funerals and what her and her family could do. These are very, very tough times, and we talk through, you know, you definitely, you know, need to know that how we mourn and how we celebrate things like weddings is going to be different. You don't want these events to be the thing that got other people in your family sick or have somebody die. And we talk through how a small amount of our family that's healthy could talk and be together that night, but how folks are postponing things, doing celebrations of life later, because they just don't want to put others in their family at risk. And these are very, very sad and very hard things we're going through together, but we are together. Stay home, Ohio, stay strong, stay together, stay at home, reach out to each other. Thank you.